This is an ABC6 News special report, coronavirus in Ohio. I'm Terry Sullivan. Let's get right to the latest numbers just released. 51,046 cases of coronavirus. That is up 737 from Sunday. 7,746 people have been hospitalized. That's an increase of 65 in the last day. And 2,818 people have died. That is 11 more reported in the last 24 hours. ABC6's Jeff Reddick is covering the briefing for us today. He joins us now by phone. And Jeff, we didn't expect the governor to talk today. Usually he's been speaking Tuesdays and Thursdays. So what's going on?
Yeah, so we were able to get in touch with a spokesman from his office, Terry, who said we will be talking about numbers today, case numbers, which would be made more clear during the briefing. Now, what we know is that numbers in other states and somewhat in Ohio have been concerning. In other states, they've been downright problematic, especially in places like Florida and Arizona and Texas, where case numbers have been rising. In Ohio, case numbers per day, daily case numbers, have doubled since the time 2 weeks ago on average. However, Ohio remains much lower on total case numbers per day or total overall since this began. Ohio remains much lower than those states that are having problems right now, again, like Florida and Texas and Arizona.
About an hour ago, the governor's office tweeted out that face masks make a difference in reducing the spread of COVID-19. Take it from the people who see it, treat it, and know it. He has stopped short of making masks mandatory in public settings. That's something several states have done. Do you think we'll see a change today?
Well, one of the things we've noted from his last news conference is that the governor, for the first time, signaled he was open to a regional model, regional strategies, ways to slow down the virus. And one of those, again, would be masking. He's repeatedly said over and over and over that both distancing, but more importantly, wearing masks in public is shown to reduce the spread of the coronavirus. That's something that he's pushed constantly at every chance that he gets in every part of the state that he visits. And so could you see maybe in the more serious parts of the state, like the Cincinnati area, where cases are rising more rapidly, could you see a mask order like has been instituted in other states? I don't think it's out of the question, Terry, but we'll wait to see what the governor says.
I know a few other states, or I should say cities, like in Texas or Miami, Florida, they have closed bars or they stopped the sale of alcohol. Florida closing the beaches for this 4th of July. I can't see him going back to a complete shutdown. I would think that he would have his committees. He had the committees making recommendations. They were made up of business people. I can't see him going that far again. Can you?
I wouldn't think so. Now, as far as the restrictions on hospitals, perhaps. I doubt it. Again, our hospital numbers are very low in Ohio right now, or as of yesterday, 661 people. And I see the governor's up, and we'll hear from him now.
Mask, my wife Fran made. I'm wearing that today in celebration that there will in fact be a baseball season, even though it'll be short. So, good news. Good news. Today I'm wearing an Otterbein University tie. Otterbein, of course, is located in Westerville. Andy Chow, Karen Kassler from Ohio Public Radio are graduates, so congratulations. Megan Wyckoff, who works for the Ohio Channel and helps with all of our press conferences, is also a grad of Otterbein. Let's start with some of the updated information from today's numbers. You start with the cases. Cases 737. You can compare that to the 21-day average. Of course, the 21-day average is going up because the case numbers are going up. So we are seeing a continued increase in number of cases. The deaths, recording 11. Hospitalization, 65. So those are up a little bit. A little bit of hospitalization today from the 21-day average. And ICU admissions are up slightly as well. So those are the key data. Let me talk a little bit more about the long-term trends in regard to hospitalizations. And hospitalization is a lagging indicator, obviously. Someone is infected, it takes a while, they get sick, go to the hospital. But last week is a significant week. From June 21 to June 27. It was the first week of increasing COVID-19 hospital utilization in the state for over 2 months. We have to go back since late April was the last time we had this much. So it's starting to go up slightly. The number of standard hospital beds occupied by COVID-19 positive patients peaked in late April and early May at about 1,000. They reached a low of 513 on June 20th. So June 20th was our low. Just last week, though, we had about 500 to 550 total COVID patients in Ohio's hospitals. Now, these numbers, of course, are not hospital admissions each day. These are just who's occupying these beds, which from a point of view of being concerned long-term about having the requisite space. So we keep track of how many go in each day, but we also keep track of what the hospital capacity is and how many are in the hospital. So again, last week we had about 500 to 550 total COVID patients in Ohio's hospitals. This week we're now at around 650. The ICU and ventilator utilization is still holding pretty steady. But we are seeing increases in those in some parts of the state. The increase in COVID hospital occupancy is most apparent in regions 2, 3, and 6, and that is Cleveland, that is Dayton, and Cincinnati, those regions. In other regions of the state, the COVID hospital occupancy had been declining, but now appears to have leveled off. In the Dayton and Cincinnati areas, the recent increase in hospital utilization does include standard beds as well as ICU beds and ventilators. Although COVID utilization in hospitals is increasing, I want to make it very clear, there's still adequate overall capacity available across Ohio. No region has reached a concern threshold of 80%, which is when the hospitals start getting concerned, of overall utilization for ICU beds. So we're not there. But we do know from lessons of recent history in New York City, Houston, Arizona, that this can fairly quickly change. I want to talk about the positivity number, which we have talked about before. And this is it is a slide that shows number of tests, as you can see, for each day, number of tests. And it also shows the positivity rate, which was at last one was at 4.7. Now I know, we have increased testing, as you can see, and we're very happy that we've done that. We're not where we want to be yet. We got a ways to go, but we've significantly increased testing, and people have done a very, very good job across the state getting those numbers up. The testing is so very important, so we can determine who has it, because many people have it and don't know they have it, do not really have the symptoms, but finding out who has it so that they can be taken care of, and also we can slow the spread of COVID-19 is so very, very important. And I know, because I've gotten calls about it, that some people think, and are wondering at least, if the increased cases that we are seeing is simply because Ohio is testing more. Certainly some of that is due to that. But the experts that we have consulted do not think it is entirely that. So what you have to really look at to make that determination, or to get some idea of whether it's caused completely by the increase in testing, is you have to look at what we call the positivity. Positivity simply is, of all the tests done in a day, what percentage can't come back positive. As we've talked about before, we've been running between 4 and 6%. Not horrible. We would like, obviously, for it to go down, but not horrible. But it's 4 to 6% is what's been averaged. What we have seen, though, that what we would expect to see, we were testing initially very restricted. People who had to have symptoms, people who had to think they might have had it. And as we've expanded it, particularly in the last several weeks, we've expanded to anybody. And so as you expand that beyond the group of people who have symptoms to a much broader group, one would assume that your positivity rate would expect the positivity rate to drop. That would be the normal thing that you would expect, because you're testing not just people who have the symptoms, but also people who have no symptoms at all. That has not happened. It's not gone up dramatically, but it certainly has not. It's gone up a little bit, but it certainly has not dropped, and that would indicate that we are seeing an increase in COVID-19. Certainly in Ohio, the cases do reflect certainly some of that. We talked last week about the two counties in Ohio that we're particularly concerned about, and we remain concerned, kind of on alert. And that is Hamilton County and Montgomery County, Cincinnati and Dayton. In fact, I was on a call with the Vice President today and with officials at the White House, and they specifically called out those two counties. They talked about a few other areas of the country, but they had a concern about those two. And so they told us that they would give us some additional help in these two communities. We'll talk to General Harris of the Ohio National Guard in a little bit. But his guard has been out, and they're out today doing additional testing. And I know the two mayors, Mayor Cranley, Mayor Whaley, have both been involved, and the county commissioner has been involved in getting additional testing in those two communities. But I want to talk a little bit about the data that we're seeing in these two communities. And I'm going to start with Hamilton County. At the end of May and into early June, Hamilton County was holding steady at an average of 30 cases per day per 100,000 population. As of this week, the average new cases per day increased to approximately 100 cases per 100,000. So they went from 30 to 100. Now, due to the delayed diagnosis, these numbers may continue to grow for this reporting period. So we assume they're not done. By reviewing other healthcare indicators, we can see that this is not solely because of increased testing. For example, more people are visiting their doctors more often and being diagnosed with COVID-19. In 1 week's time in Hamilton County between June 15th and June 22nd, those numbers nearly doubled from 40 to 78 visits per day. Additionally, we're seeing an increase in additional utilization of other healthcare services. In Hamilton County and the surrounding southwestern Ohio region, hospital utilization by COVID-19 positive patients reached their lowest level of this epidemic during the first and second weeks of June. However, as I mentioned earlier, the number of COVID positive patients being treated in standard hospital beds, ICU beds, and on ventilators has steadily increased. In fact, in Hamilton County, the number of COVID positive patients has doubled from a low of 65 on June 11th to more than 130 this weekend. Very, very concerning. Let me turn now, go up north, a little further north to Dayton, Montgomery County. We're seeing some of these same flags when we look at Montgomery County. There's a noticeable increase in cases over the last month from an average of about 10 cases a day at the end of May to about 40 cases a day in the most recent week. The community is also experiencing early signs that more people are seeking medical care for COVID symptoms. For example, outpatient visits grew from an average of nearly 7 visits per day to 27 visits per day. For the hospitals in our west central region, the region that Dayton is in, the number of COVID positive patients in standard hospital beds, ICUs, and ventilators has also doubled since the first week of June. Doubled. COVID-specific hospital utilization is approaching levels not seen since the earlier peak of the pandemic in April. To make sure we have enough hospital and ICU beds to treat everyone who needs care, such as those who need emergency surgery or in a car crash or are suffering from a stroke, we certainly need the help of all Ohioans, especially those in Hamilton County, Montgomery County, and surrounding counties, to redouble their efforts to social distance, wear a mask in public, and follow good hand-washing protocols. And again, that is not the only reason that we are concerned. We're obviously concerned about what goes on with our hospitals, but we're concerned ultimately, the most important thing is human life and protecting people. So what we are seeing in Montgomery County, what we're seeing in Hamilton County is not good. We got an alert on, basically, and we'll talk some more about those counties in a little bit. We continue to work on our plans to help schools reopen, as well as plans to keep Ohioans healthy and safe at work and in their daily lives while the coronavirus remains with us. We are in the phase of sort of learning to live with the coronavirus. And so we are working on the next phase, the next plans, which we will announce. We hope to announce at the latter part of this week. These new plans will take us into the next phase, a distinct and different phase of continuing to keep Ohio open as we head into the second half of 2020. As I said, I expect to have an update on these plans on Thursday. So we hope to be able to tell you on Thursday what the new plans are as we move forward. Therefore, our administration will be extending existing health orders through the week as we finalize these vital plans. So no one should read or speculate anything into that. We're just extending what we have right now for a few more days until we've totally developed the plan as we move forward. Barring any breaking news, we will not be having a regular press conference tomorrow because Fran and I are participating in a virtual roundtable with the First Lady of our country and members of the Trump administration to discuss challenges faced by our nation's children's service system, something that I have been interested in since the time I was a young assistant county prosecutor in Greene County. Fran and I will be sharing the work of Ohio's Children's Service Transformation Advisory Council, which I convened last fall to conduct a top-down review of Ohio's foster care system and to work on solutions. But I also look forward to hearing from other states, and we look forward, I believe, that there will be young men and women on that call, on that Zoom call, who have in fact been involved in foster care and have been part of the foster care system. So we look forward to that. The pandemic has shined a spotlight on a lot of disparities in Ohio and across our country. Shined a spotlight on disparities faced by individuals of color and by those living in poverty. Tragically, those same disparities are seen in Ohio's foster care system. So as we work to right our system in Ohio, we're greatly appreciative of the Trump administration's focus and the First Lady's focus on these same issues. And Fran, I look forward to telling Ohio's story to our federal partners as well tomorrow. I think one of the most troubling, a lot of things troubling about this coronavirus epidemic, but I think some of the most gut-wrenching things are when I hear from families who have someone in a nursing home who are not able to visit with them. We put the order in when we started this to try to save lives in our nursing homes. Cutting down on visits, cutting down on people going into the nursing homes. My job as governor is to do everything I can to protect the most vulnerable among us. Part of that job means putting measures in place to keep people safe from the virus. It also, though, means protecting those things that add value to life. And visits by family members to nursing homes, to their loved ones, is certainly something that adds value to life. And I know that this has been gut-wrenching for families not to be able to see in person their loved one. In March, as you know, we put in place an order to restrict visitation to essential personnel in nursing homes, assisted living facilities, intermediate care facilities for individuals with intellectual disabilities, and with an exception for end-of-life circumstances. And by the way, just let me mention that that exception for end-of-life circumstances has been broadened, and people should take a look at that. But we realize that the lack of in-person engagement with family and friends who live outside of these congregate settings may significantly diminish a person's quality of life who is in one of these facilities, making visits necessary to address the person's emotional wellness while safely managing potential physical health risk. On June 8th, assisted living and intermediate care facilities were permitted to facilitate outdoor visitation. And I know I've talked to people who are visiting their family members, and I look forward to going to see shortly. Fran and I do our friend Fred, who is in a facility, assisted living facility in Greene County. Today, we are announcing that beginning July 20th, nursing homes are permitted to begin outdoor visitation so long as all safety standards are met. When assessing their readiness to permit outdoor visitation, nursing homes should consider the number of COVID cases in the community, the case status in the nursing home itself, staffing levels, access to adequate testing for residents and staff, personal protection equipment supplies, and local hospital capacity. Now, having said that, it is our goal to have people be able to visit their family in nursing homes across the state of Ohio. And we know that these nursing homes have to have a little time to get ready for that. But we would hope that they will start doing that. And I know some of them have already done it. The assisted living has worked out, we think, pretty well as far as we can tell. And now we want to extend this to the nursing homes. We are in the process, and we'll discuss this with General Harris, but we are in the process of testing every nursing home. And the General and the National Guard are making progress. I know some nursing homes are providing their own testing. Our long-term goal is to test every facility and then have the staff continue to be tested. And we're working with the nursing homes to make sure that happens. So as far as the visitation, once the nursing home has been cleared, once the testing has been taken place, then that nursing home can, in fact, start opening up for visitation. Again, subject to the basic standards that we outline. Let me just talk for a moment about this decision. And again, some of the things that we did. We looked at the impact on the quality of life a prolonged loss of connection can have on an individual. We looked at requests and listened to requests from families and residents. We looked at and consulted with advocates and providers in the aging and developmental disabilities communities. We looked at guidelines for visitation jointly developed by the Academy for Senior Health Sciences, Leading Age Ohio, the Ohio Assisted Living Association, the Ohio Healthcare Association, and the Ohio Medical Directors Association. We're confident that our approach provides each facility the flexibility needed to access their readiness to safely facilitate outdoor visitation, and to do so in a transparent way that keeps residents and families informed. The order and related guidance will be made available at coronavirus.ohio.gov. And should you have any questions after visiting your loved ones, you can always contact the State Long-Term Care Ombudsman, an office within the Ohio Department of Aging, at 1-800-282-1206. We have planned pop-up testing locations to continue those pop-up testing. Those had been scheduled to increase access to testing in minority communities, underserved areas, although we'll always emphasize this testing is open to everyone. In addition, to help meet the demand for testing in areas where cases are increasing, we've added more pop-up locations, and this was one of the recommendations that was made by the White House as well, I might add, today. The Guard will be testing every day this week in Cincinnati. Every day this week in Cincinnati. And on some days this week, there will be multiple locations in Cincinnati. They will be testing today until 4 p.m. in Canton, until 4 p.m. in Lisbon, and until 7 p.m. on Waycross Road in Cincinnati today. On Tuesday, there are 2 locations in Cincinnati, 1 location in Bowling Green. On Wednesday, there are 2 more locations in Cincinnati, one at Mount Airy and one at Forest Chapel United Methodist Church. On Thursday, we have a pop-up location in the afternoon at the Walmart on Smiley Road in Cincinnati and in Circleville at the Pickaway County Health Department. Pop-up locations are being added all the time, so visit coronavirus.ohio.gov for the most accurate information. At these pop-up locations, anyone can come and get a test. Please remember, though, the Guard estimates how many tests they think they're going to have, and they bring those, so there is a possibility that they might run out. So we would suggest getting there early. Again, visit our website at coronavirus.ohio.gov and click on Testing and Community Health Centers to find a testing location near you. Speaking of the National Guard, we're going to bring General Harris in. General, thank you for being here. Good to see you again. And I want to start by congratulating you and your bride, Angela, becoming grandparents. Fantastic. I know that's, Fran, I can say that's a great experience. So, General, thank you. Thanks for joining us, and kind of tell us what's going on with the Guard in regard to the testing around the state.
Well, thank you, Governor. Good afternoon. I can say for sure that being a new grandparent and watching my daughter and her husband go through the process and having to deal with the measures that are in place as a result of this coronavirus certainly drives home the point that it's not only here, but it's going to be here for a while, and that we have to be prudent to protect not only ourselves, but the most vulnerable segments of our population. And while we know it's here for the long haul, we know that controlling the spread of the virus is job one for us, and we are dedicated to that, and testing is an important part of that. So the National Guard is fully committed to the testing, and I want you to know that our members are so proud to be a part of this process because it is so good for them, and they're so dedicated to doing something this important and this meaningful. So far we started in the nursing homes, and we've done testing in over 258 nursing homes and tested over 25,000 people. And that number continues to increase and will continue to grow. So we're building additional capacity as we look at this community, this pop-up testing, which is an important part, as I said, of not only spreading the disease, but also in helping us protect the economy as things open up. So far, we've done 19 of those sites, and we've tested over 5,000 people there. When I say test, we did a part of the test, which is the sampling, and then we send it off to the lab for the actual testing to be done. It's important to note that this is a step in the process. As with the nursing homes, where that starts with a clinical assessment, this also ideally starts with an assessment by the Department of Health. They're watching a number of measures, a number of leading indicators, which will lead us to those communities where the risk is highest, and we can start the testing there and help control the spread of the virus before it becomes an outbreak. That's the ideal situation. So we get the clinical information on the front end. The Guard goes in and does the sampling. And we have configured ourselves and our teams so that we can put small teams at the small sites and larger teams at the larger sites. So we're flexible, and we're able to scale that to meet the needs of the local health departments. So we go in and augment the local health departments, do the sampling based in those areas where we think the risk may be highest. And then the follow-on actions are probably as important as what we do with the testing. Where the results go, those positives, who gets them, the local health departments, what they do with them, obtaining that voluntary information from those people who test positive to find out who they've been in close contact with, and getting those folks to voluntarily isolate so that the disease can be controlled and not result in a hotspot or an outbreak. Now, when we do know that we have a hotspot or an outbreak, of course, as you mentioned, Governor, as we have in southwestern Ohio, we'll be there, and we'll help with the testing in order to get that disease back under control. Our teams are are comprised of medical folks. They are folks who at least are an EMT or paramedic in their local community. They have the training and the experience and the background. They simply wear the uniform in addition to their civilian job. So they come with a wealth of experience. They're going to treat everyone that they collect a sample from with respect and with dignity. That's our watchword. We ensure that when the community comes in contact with the Guard, that it's a positive experience. So we collect the sample in the most least invasive way possible. Sometimes that's difficult, but this is complex. There are lots of different samples out there. Different labs take the samples different ways, different forms. So our teams are comprised not only of those medical professionals, but all the administrative support and all logistic support to not only get the collection material, but also get the samples where they need to be to that lab that can process them in the most timely way. We're very respectful of the medical information that we collect. We don't keep it. We pass it on to the health department. And I want to emphasize that the local health department has a lead here. We're here to support them. This response is local. We're here to support the local response, and we do the best job that we can. But the local health department's responsible for not only making sure that the community is aware of where these sites are, but also in the overall strategy for what happens with the results afterwards. So it is great pride for us to be able to support them in that effort, because we know that they're putting in yeoman's work and that we're in this for the long haul. So the National Guard is here. We're committed to this endeavor for as long as it takes. As I mentioned, we're building additional capacity so that we don't degrade our operation in the nursing homes as we move into this new space of community testing. But we're committed to it because, as I mentioned, it's very important. It's very important. And in addition to all the other measures, testing alone doesn't do anything if the other measures aren't in place. If we don't have the tracing that follows up, if we don't have people properly wearing masks when they go out into public spaces, if we don't have the social distancing, then testing simply becomes a way of chasing measures and metrics, and we lose our ability to get ahead of this disease. So we're awfully proud to be involved to help control the spread of this virus until there is a vaccine, and we're in this for the long haul.
Well, General,
so, Governor, thank you for the opportunity to participate. Thanks for an opportunity to be a part of the team. And as I mentioned, our Guard is awfully proud to be a part of this very, very, very important effort. Thank you, sir.
Well, General, I can't thank you enough and the men and women of the Guard. As you know, several of them were in here at our last press conference, and we got tested, and it was certainly not a traumatic experience. They did a great job, and we got our results back. So we hope we know everyone will have a good experience. And we just would again urge everyone, particularly if you're in those areas where we're seeing a significant uptick in Hamilton County, for example, Montgomery County. We're also starting to see some in Cuyahoga County. We would just ask you to get tested. But General, thank you. We're very grateful. Good to be with you.
Thanks, sir.
Last week, we heard from Dr. Rick Lofgren from UC Health about the situation in Hamilton County. And as we said, we focus a lot today on Hamilton County, on Montgomery County. Today, we'll hear from Dr. Michael Doan, the Medical Director for Public Health, Dayton, Montgomery County. The doctor's professional experience includes clinical care, research, 15 years living and working in the Spanish-speaking Caribbean doing community health development. He served for more than a decade on the full-time faculty at the University of Cincinnati College of Medicine, and has also served on the faculty of the Wright State University Masters in Public Health program. He received his medical degree from the University of Cincinnati and his public health degree from London School of Hygiene and Tropical Medicine. Doctor, thank you very, very much for joining with us. We appreciate it, and I wonder if you could just kind of give us a rundown of what you are seeing in the county.
Thank you, Governor DeWine. I think that your synopsis was really very good in terms of we were averaging around 10 cases per day, and now we're up to 4 times that number. The Montgomery County residents, when the original stay-at-home orders came through, were very good about being compliant with that and about staying home. We know from the cell phone data and other measures that the community really responded to that. And we had very low case rates. As testing became more available, we expected to see more positive tests, but what we're seeing now is not what we were hoping for or could be explained by simply the testing alone. we have more cases, we have more people seeking medical care, and more people going to the hospital and being admitted to the hospital. The hospitals still have plenty of capacity at this point, but it all indicates that there are more people who are getting sick with this disease than there were previously. We're also seeing something we hadn't seen before, which is clusters of a couple dozen cases related either to a workplace, in some cases to a single church event, where people have been able to spread this virus amongst themselves. So that at this point, we're concerned that, especially with the holiday weekend coming, that we're going to see continued mixing of people and some continued increases in the cases, which makes us sad because we think this is something we could prevent in so many ways with just simple measures like wearing masks and maintaining that 6-foot distance.
Well, thank you very much. Are you seeing anything else in the data about who is getting sick? If there's any change? I know we've seen in some other states, it appears as some of the more younger individuals, 20 to 40 maybe, seem to be showing up more. Are you seeing that in Montgomery County, or any change in that at all?
Yes, well, as has happened other places, at this point, the group that's 20 to 39 years old now accounts for well over a third of all of the cases, which was not the situation previously. And one of the things that worries me about this is a new virus, and we don't really know what the long-term effects may be, so that even if younger people may come through the acute illness in better shape than older people with less complications, we're not sure what the long-term implications are going to be. And the reports, for instance, that there's decreased lung function afterwards. If I'm young, I've got a lot of extra reserve lung function, and I may not miss it at this point, but at some point in the future, I may want to draw on that as I get older. And so I think that's a concern to me as well. Also, just the sort of intermixing of people. If the more that we see cases, the more that we see younger people beginning to get this disease and perhaps being able to spread it unwittingly to others around them, the more concern we have for the vulnerable populations, people that are already sick, even people in those age groups may have quite a bit of trouble with this virus, even if they're younger, if they have underlying diseases. And so that's a concern to us at this point.
So you could get, I guess, someone who's 20, 30, could get it, and then you may see another bump then beyond that, maybe to somebody older, I guess. In other words, a person who's young gets it and may go home. The classic case that I always talk about is, if you're 20 or 30, you need to worry not only about yourself. If you don't worry about yourself, you need to worry about someone older or someone who has some medical problem that you might end up giving it to. And I don't know anybody that, even if they think they're invincible, no one wants to hurt somebody else and give that to somebody else.
Exactly.
Doctor, any final advice as we move forward for people in Montgomery County? You talked about it is a holiday, and 4th of July is coming up.
Well, I think everyone sort of knows the rules at this point, if you will, that we should maintain 6 feet distance, that we should wear masks. Certainly, if we're inside, there's much more chance of transmission than if we're on the outside. Still, the masks can be helpful inside and outside in maintaining that distance. One of the things that we've encouraged people in Montgomery County to do is to just be aware of your surroundings and look at what's going on. And if you find yourself in a situation where you feel people are packed too tightly, a lot of people aren't wearing masks and trying to protect you from themselves if they should by chance have the infection and not know it, we're asking people to make those assessments, watch where you are, and if you're uncomfortable in a situation, then move out of it. Find a place that you can go and that you can enjoy the weekend, and you don't have the same kinds of chances of transmission and of getting the virus. So whether it's a store, whether it's a park, whatever the situation, we're asking people just to be very watchful and to take care of themselves and to be thoughtful, not only of other people by wearing a mask, but just thoughtful about their situation and whether they feel safe in that situation or need to change that.
Good. Dr. Doan, thank you. We appreciate it very, very much. Thanks for all you do, the people of the county.
Certainly. Thank
Appreciate
you.
it. Thank you. Lieutenant Governor.
Thank you, Governor. Good afternoon. We have often said from these news conferences that COVID-19, the virus, is going to be with us for some time. And we have a responsibility to learn to live with the virus in our lives, to protect ourselves and to keep us safe and get Ohioans back to work. Some good news is that the economy is beginning to recover. We're seeing jobs. There were about 100,000 jobs added last month, and people are going back to work. But as we've seen in Florida and Texas and Arizona, this thing can come back. It's sending those states in reverse with business closures. And as we talk to businesses in this state, that's their worst fear. They don't want to go backwards. None of us want to go backwards. We do daily calls with business leaders. We were on the phone with the Akron Chamber of Commerce this morning, the governor and I, talking about these issues, a big fear of theirs. And with the cases rising in Southwest Ohio, I know that the business community there is growing concerned. And so we wanted to bring on one of those companies that are just smartly addressing the issue and how they operate in the community with their employees. We have with us today the RFC Group of Westchester. RFC specializes in commercial design, laying out efficient workspaces for offices, healthcare, education, and government settings. And they have about 70 employees across Ohio and in northern Kentucky. And joining us right now is the president and owner of our RCF, Carl Satterwhite, and his business partner, Scott Robertson. And I want to thank both of these gentlemen for joining us. They will be joining us here quickly. We're hopeful.
While we're waiting, let me just say also that Andrew Tobias, Cleveland.com, just tweeted me and said that he went to Otterbein as well. So congratulations. Sorry I missed you.
Well, while we're waiting on Carl and Scott to join us, I can just say that we've had continued conversations with businesses across the state and talked a lot about what they can do. There's always we know the things right now: the distancing, the disinfecting, and the wearing of masks, and it's so very important to manage the virus that we continue to do these things. As I've talked to a lot of folks, one of the challenges with coronavirus is that so many people just they feel a little powerless. They're like, they feel that the coronavirus is impacting their lives, and they don't know what to do. They feel a little powerless. That's a feeling that none of us like. And as I mentioned, with the cases rising in Florida, Arizona, and Texas, businesses ask these questions. What can we do to make sure that we don't close down? I've also had some conversations with some professional and high school athletes that want to have a season, and they're saying maybe they're young and strong, and they want to know what to do. And remember, I was taken over the weekend to see former Vice President Dick Cheney in his cowboy hat and his surgical mask that looked a lot like this, talking about what this can do. And there was a study that came out that from the Lancet that did there was a review of 172 studies, and it said the mask could result in a large reduction in the chance of risk of infection. And there are lots of masks. This is the N95. These are mostly for folks who are in medical settings, and I believe we now have Carl and Scott with us. So, gentlemen, can you hear me?
Yes.
Great. Well, I was saying that you have taken a great deal of effort in your business to create a safe work environment for your employees and those employees who go out into the community. You are aware of the trends in Southwest Ohio, and as a Southwest Ohio business, I know you represent the voices of many businesses that want to make sure we go forward and not backwards. And want to just give you a little bit of an opportunity to share with the public about what you're doing to keep your employees safe, to keep a safe environment when you go out into the community, and to help make sure you're doing your part and encouraging others to do their part to control the spread of the virus. So I'll start with you, Scott.
Thank you, Lieutenant Governor. We serve many essential businesses, 5 hospital systems, financial institutions, et cetera. And so it was important for us to be able to stay open and be healthy and follow the appropriate protocols. So we have a return to work plan, not only for RCF Group, but for all our clients, many customized in their own way, because corporations behave differently, hospital systems behave differently. And this, as the previous speakers have said, and you and the governor have said many times, this is to be respected, and we need to learn to live with it. And we're all hearing it a lot, but it is about wearing a mask. It is about social distancing and about washing your hands and being respectful of others. And so here at RCF Group, we've done those things. Carl?
Thanks, Scott. For this opportunity to be able to share. Also in our toolbox are these 2 o'clock briefings. And they're allowing us not only to just talk about the things that are important, but also to be about those things. So we are actually actionable advocates that are exhibiting many of these statewide messages. So as we continue to be able to do that not only for our staff, but also for the customers that we do business with, we're also able to share corporate best practices. We're very fortunate to be able to be working with large corporations across the state, and we can also learn and grow from the things that we exhibit and see from them. So we're able to be that kind of a conduit to be able to share those best practices across many spectrums. Because obviously in the midst of COVID, we have folks working from home, folks working in the office, and we have hybrid solutions. So we're having to be between all of those messagings to be able to deliver those best practices. I would add that a lot of what this is about is leadership, is leading by example. So Scott and I can't just talk about these things without doing them. So we wear a mask. We exhibit that always. We make sure we have 6-foot distancing. And even just this morning, we really added a step of, as we start returning employees from home, trying to find a way to get some texture around what kind of exposures they may have in their homes and in around their worlds today. So we can be better prepared to be able to deal with those situations when they come back into the workplace. And I think those are the things that all businesses will need to be looking at as employees come back home to their workplaces, because, you know, this pandemic that we're dealing with is across all sectors. So it's being seen across the community in many different places in different ways. And particularly as we're seeing asymptomatic young people, young adults, who can maybe pass these things on without any symptoms. We got to know that we could be carriers nonetheless. So, you know, it's about leading by example. And we're very proud to be amongst the business leadership in this region that is not only exhibiting those behaviors in the workplace, but also working in the community to try to be change agents.
Yeah, it's a great point about your employees, because even though you can have them in a setting where they're going to be protecting themselves and each other during the workday, it's what they do afterwards at home in their social lives that also can impact that workspace. And it's great to hear that you're having those conversations with them. Do you, you know, I'm sure you do, but do you believe that that businesses are having those conversations with their employees to emphasize that importance?
Absolutely. And those are the things that we're trying to share within our leadership meetings as well. So as we learn things and we see things across the community with other corporations, best practices, things that are working, we're trying to be quick to share those things so that we can also be making a better region for us all.
And obviously, as a business owner, you're trying to balance the health and the business aspects, but you're showing that it's possible. You can create a healthy environment and you can have a successful business at the same time.
Absolutely. And, this is going to be a long road back for the whole state. So all of us doing the right behaviors. I'm very proud when I watched the reports to see that Ohio's in a good place. So like many, I've been alarmed that we have been spiking as a result, I believe, of not staying diligent as we had been earlier in the process. So we clearly, as a business community, want to be a part of changing that trajectory and start making sure that we can start bringing our own numbers down as we continue to test, but make sure that we are exhibiting the practices that your leadership is giving us on how to function in the workplace.
And as a final question, as we see the cases in Southwest Ohio begin to rise, you're a Southwest Ohio business. What's your message to other businesses and the people of Southwest Ohio?
Well, my message would really be to exhibit from the top. This is something that is difficult to just talk about if you're not going to be walking it out. Staff, employees, customers, and community are really watching our behavior. So we can't say do something and not do it. We have to be the evangelists in the moment right now so that we can actively advocate for change and leaders can be seen walking out the change they want the community to be.
Great. Thank you very much for joining us.
Thank you both. We really appreciate it very, very much. We're ready for questions.
Hi, thank you. Jim Oddie from WHIO TV. Thanks for being with us. Governor, we've seen some other states, governors in other states that have had more than just an uptake of new cases. They've actually had a resurgence in multiple counties. Are we on that same path here, or do you think you can ride this out? Is that one possibility for the state of Ohio that within 1, 2, or 3 counties that are having problems, we could see bars close, restaurants step back, and some other restrictions come back again?
Well, I think what you're seeing in Texas, what you're seeing in Florida, what you're seeing in other states is certainly not what we want the future to be for Ohio. And I think that it should be a cautionary tale. When you turn on the news and that's what the lead story is, that should frighten us. It frightens me as the governor of Ohio. And that's why we're working so very, very hard, frankly, to talk about wearing masks, to talk about keeping the distance. That's why we've had doctors Skype in from Dayton, doctors Skype in from Cincinnati in the last 2 press conferences. We're very concerned about what's going on in Southwest Ohio. We're very concerned about Hamilton County. We're very, very concerned about Montgomery County. We need more people to wear masks. We need, when people go into a restaurant, when people go into a jewelry store, when they go in and buy anything inside, they need to have a mask on. So these are things that we know that we can do. So as we used to say when I was a prosecutor, the jury's still deliberating. The jury's still out. We don't have an answer yet of what our future looks like. We determine our future. Just as Ohioans determined their future during the early parts of this virus and did a phenomenal job, we have to do that now. The other side of that is testing, and we're gung-ho on the testing. We're pushing it just as much as I can, and our capacity is going up. We need more people to show up, particularly if you're in Dayton. Go get tested. If you're in Cincinnati, go get tested. We have these pop-up testing opportunities out there. Please go ahead and do that. That's why Fran and I did it the other day, and John, just to show people that, hey, this is not tough. This is something that you can do, and it's something you can do for other people, just like wearing a mask is. So we're going to have to see, Jim. We're going to determine our future. But the one thing we've learned throughout this virus, and we've seen time after time, what we do now is going to impact where we are in 2 weeks, 3 weeks, 4 weeks. And now's the time to get serious about it. We're headed into the 4th of July. Look, this is a time when people, get together. We're not saying don't get together, but just be careful. Be careful. This virus is still very much out there. And as we heard today, even for young people, we're seeing young people get awfully sick sometimes. The death rate is not real high, but some of them have gotten very, very sick. And what we don't know, and what the doctor indicated, is many, many times, we're not sure about what the long-term medical ramifications are about that person getting sick. They may survive, they may come out, but maybe they got decreased lung capacity. And how's that going to impact them in 10, 20, 30, 40 years? So we're right in the middle of this game. We're right in the middle of the game. We're going to determine the outcome.
Hi, Governor. Andy Chow with Ohio Public Radio and Television, State House News Bureau. Just wondering, do you happen to have any more data, any more information that points to specific circumstances for why the cases are increasing? Are the cases coming out of people going to certain businesses or gathering in certain places?
That's a question I should have asked the doctor, but the answer to that is I don't. What the people in Montgomery County are telling me, and in Hamilton County, the health people as well as our own people, is that this is community spread by and large. In other words, these numbers are not really driven so much by a nursing home. There may be nursing home numbers in there. I don't mean that, but this is community spread. That is spread in the community. People are not being as careful as they need to be, and the spread continues. So, but I don't know that there is any one answer. The impression I get from talking to people on the ground and people who are looking at the numbers is that there's no one particular answer to that. It is basically community spread that is occurring.
Jack Windsor, WMFD TV in Mansfield. My question is going to be lengthy, Governor. I appreciate your patience in advance. In the beginning, when we were testing the sickest and the infection rate was naturally higher. You said today percentage positives should be decreasing as testing increases. That would seem to be the case only if the virus were losing contagiousness. Is that what you're saying, Governor, that you expected the virus had dipped in contagiousness? And then secondly, we've also heard from hospitals like OSU Medical Center and a facility in Cleveland that hospitalizations are going up because of deferred care. People are there for reasons other than COVID and getting mandatory tests, and if they come back positive, even though they're not there for COVID, they're being counted as a COVID hospitalization. And then finally, so is that the case? And then finally, we've also heard that tests can be false up to 40% of the time and maybe detecting antibodies and returning a positive result. Governor, do you think increased testing might be picking up positives that aren't actually active virus cases as well? Thank you.
Take them in reverse order, Jack. We have no indication that 40% of these tests are wrong. I mean, all the medical experts that we're talking to, all the lab people we're talking to, it certainly gives us no indication that, that there's a huge false positive numbers coming up. Again, the medical experts would be the ones to ask that, and not me, but no one is telling me that. No one's giving me that indication. Number two, in regard to deferred care, I'm sure that you're right in the sense that there are people going into the hospitals for deferred care, and we want them, frankly, to do more of that and to catch up. But the numbers I cited, the numbers we reference, are COVID related. So those are separate from the numbers of the people who are in the hospital. So we look at how COVID is starting to increase. So that's how the numbers we look at. And I'll go back to the kind of the bigger question that you raised. And again, I don't pretend to be the medical expert, but every medical expert I've talked to said you look at the positivity rate because it's important, and everyone who I've talked to says that as you increase testing, you should have if everything being equal, you should have a decrease in positivity. So let me just kind of take everybody through that and maybe put it in words that I understand, and that is that, you know, when we started this, we were very restrictive in regard to who got tested for many, many reasons, or the unavailability of the testing or the scarcity of the tests. And so the people who were tested were people who had symptoms. You had symptoms, you got tested. Today, as you know, we've thrown the doors open and we've said, please come. And you've seen numbers in Dayton, we've seen numbers in Hamilton County, pop-up testing, anybody can walk in. So when you go from a group of people who all have symptoms to a group of people who maybe some have symptoms, one would assume if everything is staying equal, as you expand your universe, the number is going to go down. That's what every expert says. Our number is not gone down. In fact, it's gone up a little bit. I think it was down a little bit today, but it's been fairly flat, maybe edging up a little bit. That is not what you would expect to see if things were staying flat. So that's the answer that they gave me. That's my understanding of what the facts are. Thank you.
This is Jackie Borchert from the Cincinnati Enquirer. Governor, what metrics will you be using going forward to determine whether some next steps need to be taken, whether in Hamilton County or Montgomery County or another part of the state? And what will that next step be? Will it be mask mandates or county-specific closures? What are you looking at right now?
There are 7 metrics that the health experts are looking at. I will go through those next time because I don't have them written down in front of me, and I'm afraid I will say them wrong. But we'll do that on Thursday, and we'll go through the 7 metrics that are there that they're using. And so when I come in, as I've done the last several times, and say we're worried about Hamilton County and we're worried about Montgomery County, that is not me looking at numbers. I mean, I can look at numbers, but it is taking 7 different metrics and seeing how those line up, and if they're going the wrong way. For example, out of that 7, and I apologize, I don't have them in front of me, but out of that 7, Montgomery County was going the wrong way on 4, and Hamilton was 5. That's why the alert goes up. That's why the warning goes up, and we start talking about those 2 counties. We're not liking what we're seeing in Cuyahoga County either, but they haven't reached that stage, according to the health people who are looking at this data every single day. So the answer to your question is we're going to watch these numbers, and when we get an alert, we're going to tell you that we have an alert, and when we become very, very concerned, we'll see where we go. But again, the alert is out there today and last week, and the reason we're talking about it is we want people in Montgomery County and surrounding counties and Hamilton County and surrounding counties to know the data is not looking good. And so we can control our future. I can work on more testing every day, which is what we're doing. And we're getting a lot more testing. And that's one way to run this devil down. But the most important thing we can do is what individual Ohioans do. And as the Lieutenant Governor was saying a moment ago, if we want to be able to go out and live our lives, this mask is a symbol of freedom. It's a symbol of freedom because it's going to, if we wear these, if we get 75 to 80% of the people who are out in public who are wearing this mask, we are going to see these numbers get better. And any kind of thing that we might do that you're talking about, we will not have to do. So this is what we need to do. We need to focus.
Will you make those metrics publicly available to show how the different counties are doing? I know some other states have devised similar, like red flag, for example, like a different color scheme to kind of show people where they're at and how concerned they should be.
Talk a little bit about that on Thursday. We will, and I'll go through the 7 metrics and talk about what those are, and so that what we want people to do is to have confidence in what we're looking at and what we're relaying to people, and it should be, I hope, give people some confidence that it's not just our team here in Columbus that's looking at numbers. This is why we've had people in from health departments, and we talk to health departments in Montgomery County, we talk to people in the health department in Hamilton County, we compare notes, we see where they are, and so we're in agreement with them, they're in agreement with us. We have a problem in those 2 counties.
Good afternoon, Governor DeWine. Ben Schwartz with WCPO. Governor, today my question is one that was sent in from a high school English teacher in Ohio. She says that while she hopes accommodations can be made to allow students to return to school in the fall, she's worried about some of the rhetoric surrounding the reopening of schools that's more been focused a lot on the safety of kids, but that she hasn't heard a lot of concern about the safety of teachers, many of whom are older and more at risk. So my question really is, are you looking at that as well as the safety of the students while reopening?
Absolutely. I've in discussions with superintendents, I've said, what should you worry about? And if I was a superintendent, I certainly would worry about anybody, a student or an adult who had a medical problem, compromised medical situation. I would worry about an adult. The older adult gets, the more dangerous this virus is. So every school has people that we should worry about. I mean, we're going to worry about the kids. We're going to worry about everybody. But absolutely, no, this has been one of the major things that we've looked at, and I will add to that. And it's not mentioned very often. But when we talk about child care, we worry a lot and try to be careful to protect those who are working there, because you have some people who are working there, just like in a school or any place else, who might have vulnerabilities, medical vulnerabilities, might be of an age that their risk factor is significantly up. So we worry about the kids, but we also worry about the adults.
Hi, Governor. This is Molly Martinez with Spectrum News. So we're seeing a surge of hundreds of cases, yet from what I'm understanding today, we are staying the course. In these 7 metrics that you're talking about that are coming on Thursday, is there a number of cases or is there a threshold in which we begin to reevaluate? Also, a few months ago, you sent out a blitz of contact tracers. Have they been successful, and have we gotten any information from their efforts?
Yeah, I mean, the health departments tell me that the contact tracers are doing what they're supposed to be doing, and that the results are what we would expect. I mean, I was on the phone the other day with some health departments, and I asked them the specific question, are they getting turned down a lot? Is that a problem? And at least on the call I had and the people I was talking to, they did not say that they were having a problem of anything above a normal rate of people not wanting to cooperate. The other part of the question, Molly, was first part had to do, I think, with Molly. This is a process where we continue to learn. We continue to see what happens other places. We continue to learn about this virus. So it's not like we can draw, the knowledge continues to evolve and the ability to evaluate it continues to evolve. Having said that, we have 7 metrics which we'll go into next time. And when you start to see higher numbers of these being reached, the concern needs to go up. And we'll go through those numbers, and not the numbers, but we'll go through how that is calculated. Look, the big picture is this. What we hope is that people will do what they need to do, just as Ohioans have done this throughout this. We've had a little summer now, and people are out, and sometimes people are, not keeping the distance and not keeping the mask on, and the cumulative effect is what you're seeing in these numbers. So now's the time to get serious about it. Now's the time, if we want to be able to do things later, we've got to keep control of this. We just don't want this to spike up and get out of control. And we know that what we do today, movement today is worth a lot more than movement in a week. And so this is something we have an obligation to tell the people, and the county is impacted and throughout the state. This virus is still here. It is not over, and we got to get serious about it.
Hello, Governor. This is Luis Gil with Ohio Latino TV. Governor, as we see the spread and the preoccupation in the Hamilton County and Montgomery County and throughout Florida and Texas, the large gathering seems to be the problem. Through the protesters that were here in Columbus and several cities in Ohio, perhaps that helped the spread, because we didn't see them with social distancing, mask, and so on.
I don't have any data, but I think any time with as much community spread as we now have, anytime you see groups of people together who are not keeping a distance and who are not wearing masks, you can pretty much bet that there's some spread going on. I think that, I don't have any way to quantify it, but anytime people are coming together and not keeping a distance and not wearing masks, you're going to certainly see spread. I don't think there's any doubt about it. I can't measure it, but there's no doubt about it. And that's why we've asked protesters, we don't infringe upon the First Amendment. So we don't infringe on people's right to go to church. We don't infringe on people's right to go to a funeral, a wedding. We don't infringe on people's rights, and we put nothing up, no barriers. The same way with protesting and freedom of speech. But we ask them, think about your neighbors, think about your friends, and please, please take care of yourself and take care of them.
Thank you, Governor.
This is Laura Hancock from Cleveland.com. Hi, Governor. What are your thoughts about the mass gathering order? Do you want to continue it through the summer? And how do you think people are doing in terms of following it? Just your thoughts there.
Well, we're taking a full look at everything, and we're going to have a whole, basically, new plan to lay out for you we hope on Thursday. So we're going to have to hold, because I think looking at it holistically is probably the right thing to do. Look, what people are doing, you're seeing the same things I'm seeing. You're watching TV. You're seeing what's going on. You're reporting, of course. So, look, some people are and some people aren't. And we just have to get more people to do it and fewer people not do it. This is literally a matter of numbers. And we don't need 100%. We don't need 100% social distance. We'd like it. We don't need 100% people not wearing or wearing a mask. We'd like it. But if we can get 75, 80% of people, when you walk in a store and they've got a mask on, we're going to be doing okay, and we're going to get through this. If we don't, and we see it, Fran and I see it, we go in a store and don't see that. So it's a problem. And part of what we're trying to do is tell people, here are the numbers, here's what we're seeing, here's where the spots are where we're concerned about it. We got numbers moving up statewide. It's time to get serious about this. No.
Governor, this is Jake Zuckerman from the Ohio Capital Journal. You've spent a lot of time here encouraging the use of masks, hiring contact tracers, and issuing public health orders. The legislature, and most notably House Republicans, have voted against the use of masks, discouraged the use of masks in campaign messaging, put out misinformation about contact tracing, and stripped the ODH director, or attempted to strip the ODH director of certain abilities. Do you think the legislature is undercutting your efforts here?
My persuasion isn't good enough, or I'm not doing a good job persuading. I continue to work on it. So, and I'm going to continue to work on trying to persuade all Ohioans that this really is the way to exercise our freedom. It's the way to be able to live our lives, and that the consequence of not doing these things is a lot worse than the small inconvenience of wearing a mask and the small inconvenience of staying back. Now, look, I don't underestimate it. When you're dealing with families, for example, and people cannot get together, that's big. That's big. Fran and I see that with our family. So, you know, we're all, that's the toughest part, I think, for people. But, you know, what we all want to do is be around for, you know, our grandkids' future birthday parties and future Christmases and whatever holiday that we want to celebrate. And this thing will end. And the other thing I would remind people that, you know, I've had some people who kind of fatalists who say, you know, well, everybody's going to get it, or most people are going to get it eventually anyway. Well, I don't believe that, but even if you believe that, you're better off getting it next January than you are today, and you're better off today getting it than you were 3 months ago. So the medical care is getting better, understanding of it is getting better. There may be more drugs come out, who knows? So there's all the incentive should be in not getting it. There shouldn't be any incentive to get it. And so, again, life is full of balance, and we all take chances, but they're calculated chances. You know, we all take some chances, but, you know, they're calculated. And we're just tell people, you know, lessen the odds that you're going to get it. No one can guarantee you won't get it, but you can dramatically lessen those odds by doing what medical scientists are telling us each and every day. And I guess what, you know, I don't quite understand sometimes, and I get a lot of emails and a lot of texts, but why there's just this disbelief in what the scientists are telling us about the spread of this virus. And it's not complex. There are things that we can do. They're within our hands. They're within our control.
Governor, can I add
Yep.
something to that?
Yep.
Look, I think that all of us at some point in time are going to be asked as public officials, because this is going to be with us for a long time. We're all going to be held to account on what we tried to do to contribute to be part of the solution. And I would just ask everybody in a leadership role, what are you doing to do your part to help make this better? What are you doing to help control the spread so that we never have to look and contemplate the idea of closures again because the virus gets out of control? That's, I think the goal we all have is to keep people safe and to keep the economy open and preserve the freedoms that we have. And these masks, my daughter made this. My daughter Katie took an old T-shirt, sewed it together, two-sided, and we all can just do these small things to make a difference. We're not asking for big sacrifices. We're just asking everybody to do their part.
Hi, Governor. Max Philby with the Columbus Dispatch. I'm curious, as you're making more reopening decisions and whatnot, first of all, how much will the R-not factor into your decisions going forward? And secondly, is it possible we could see your reopening approach shift to a county-by-county basis more moving forward?
We're going to move towards more county by county, and I think you can tell that. That's the way I've been talking in the last week or so. And, you know, the data is good data. It can be broken down not just by county. You can break it down by zip code. And, you know, gives us the ability to warn people, give them a warning, give them an idea of where we are, do an alert. whatever you want to call it. So yeah, we're certainly moving in that direction. You know, we know more today than we did when we started this, but we'll have more. We'll talk more about that on Thursday.
Adrian Robbins with NBC4. Governor, thank you for doing this today. Over the weekend, the governor of Texas expressed some regret to opening bars too soon. As our cases begin to rise, do you look back and regret any of your decisions, whether it be reopening bars or the reversal in the mask mandate, especially now even the vice president says it's important to wear a mask?
Well, I've always said it's important to wear a mask. You know, I made the decision, right or wrong, that mandating at that stage, when we were earlier, mandating that every Ohioan out in public wear a mask was something that a significant number of Ohioans would not accept. So that was the decision. You know, when we all look back at the virus in our rearview mirror, which is a day we are looking forward to, you know, we can go through and look at the different mistakes that I have made as we've gone through this, and I'm sure that there's going to be plenty of them. But I felt we needed to get back to work. I also felt that as we got back to work, we needed to put in place some good practices. We have good practices. I think we've done as well as any state in giving people guidance in how to open their business, how to open their profession. But as many people told me, there's a lot of huge consequences of not being back open. And there are some very, very bad consequences that impact people's lives. So we are trying to balance this, and we're trying to do these two things at once. I think we can do them, but it truly, truly is in the hands of everyone who's watching TV and maybe a lot of those who are not watching in what we do. And you know, we control our future. We do not want our future to be what we're seeing in Texas. We do not want our future to be what we're seeing in Florida. We can control it. We determine what this thing is going to look like in 2 or 3 weeks by what we do today. So it's my plea to my fellow Ohioans. 4th of July, wear a mask. By the way, I'm going to have an Indians one on Thursday, so we're celebrating baseball. But we can have fun with these masks. Fran's made this one. John's daughter made his. And look, we can have fun with all of this a little bit. But it's serious business, and you know what we can impact is the testing. And we were lagging in the testing. We're catching up. We're moving in that. But what people do as individuals is just vitally important every single day.
Hello, Governor. This is Shane Stegmiller from Hannah News Service. As we were opening back up and the country was opening back up, there was a lot of talk about doing antibody testing to see who might have already had the virus, kind of give us an idea of how far it's spread. Is that still in the plans? Where are we at on that? Will there be any antibody testing still?
There's going to be antibody testing. It's a question of availability, but certainly there's going to be more. Antibody testing is occurring in Ohio now, but I don't have any data on it. So we will. I'll take that as a hint to try to get back with you on some data.
Widespread, or you just don't know at this point?
Numbers. I mean, it does appear on my report, and so I can't remember what the numbers are. It's a much smaller number, of course, but I'll get that for you, or Dan can get that number for you. We can give you some numbers on that because we do have numbers on that.
Thank you, Governor.
Good afternoon, Governor. Jeff Reddick with ABC 6 News here in Columbus. Long briefing today. Thank you for taking all these questions. Wonder if you could just reconcile for a moment. You began the news conference talking about how much more serious the numbers have become in certain parts of the state, and then announced the order to allow more visitation at nursing homes, where our most vulnerable population lives. Can you reconcile the two?
Yeah, I mean, we've looked at this visitation in nursing homes for a number of months. We are now a number of months into this, which simply means that there's a lot of people who have been locked up and cannot have visits from their family. And so we've weighed this. It is weighed heavy on me, I will tell you that, and on Ursel McElroy, who heads up our Department of Aging, and on anybody who has looked at this, because these are tough decisions. On the one hand, you do not want to introduce the virus into the nursing home. But on the other hand, I know Ursel has told me the number of people she's talked to, and I've talked to some, she's talked to a lot more, who just say that their loved one is going downhill in the nursing home. Some have dementia. It's difficult to explain to them why that their mom or where the son or daughter isn't coming. They're not showing up. It's hard to explain that to them. They don't really fully understand because of the dementia. So these are very difficult things. And so what we've outlined is a very thoughtful process. I think that virtually every group that has looked at it, it's gotten input, and we've taken everything that everybody has said into consideration, so that once testing is done in the nursing home, and if they don't have the virus in the nursing home, then other things have to take place as well. Then visitation can take place outside. It's summer. Weather's good enough that people can be outside generally for a while. And we know that the spread outside is dramatically different than it is inside. And that people wear masks, and that we believe that with the proper precautions, that this visitation, which family members tell me, and I can fully understand, is just very, very important to their loved one, and their well-being, their physical well-being, their mental well-being, that visitation can take place in a safe environment. So, tough call, good question, but you got to make these decisions. And again, we've had for a number of months people who've not been able to see anybody in their family. So it's going to be very carefully done.
Governor, could I add just a point to that? Is that like so many of these questions that we contemplate, there are health consequences of action and inaction, but with nursing homes, we're so much further than we were months ago when this was put in place because of all the testing that's going on there. Very aggressive testing from the National Guard and from the nursing homes themselves, which have really helped to contribute to making those environments a much safer place.
WBNS 10 TV. I'm the last question today, Governor. Thank you again for your time. Franklin County leads the state in the number of cases and the number of deaths, but there was no mention of that county that seemed to be raising concerns for you today outside of Hamilton and Montgomery. I was wondering if you could explain why. And second of all, the Franklin County Health Commissioner told me today he believes that the bars and restaurants did open too early, and he says it's time to start having that difficult discussion about perhaps moving in a different direction. I wonder if you can address that as well. Thank you.
Your first question first. It's not that we don't have a concern about Franklin County. It just is not in that top tier today. That may change. What I'll try to do, or what I will do, is to give you a more thorough kind of description on Thursday of what we're seeing with all the counties, kind of give you an outline of that. As far as the health commissioner's comments, look, this is the type discussion that needs to take place. The concern about, why there is the spread, what's causing the spread, is multifaceted. But having a discussion like that is very, very proper and very, very good. Our data is good, but sometimes it's hard to drill down to, exactly where that person got it. But that's, again, something that we're going to continue to look at. So, everything is open for assessment, but again, individual behavior is the way that this should, and we hope will get dealt with. So when people go to a bar, there's enough restrictions about them supposed to be seated, et cetera, that if people follow the restrictions, then they'll be okay. But it's certainly something that we need to look at it. I want to thank you all very, very much. Sorry we changed the date on everyone, but we got the invitation from the White House to talk about foster care, which I thought was very important. Fran and I look forward to do that tomorrow. And we will see you all back here, we hope, at 2 o'clock on Thursday. Thank you.
51,046 cases of coronavirus now in Ohio. That's up 737 from yesterday. 7,746 people have been hospitalized, an increase of 65 in the past day. And 2,818 people have died statewide. 11 deaths reported in the last 24 hours. The governor said what is happening in Texas, Florida, and other states is a cautionary tale that frightens him. He said we need more Ohioans to wear masks and get tested. He said last week was the first week of increasing COVID-19 positive hospitalizations in the state in more than 2 months. He said we are starting to go up slightly. And the governor said we're finding more cases, not only because we are testing more people, that's not the entire reason. He said the virus is spreading in communities. DeWine said there are 7 metrics that county health directors look at that determine the virus threat levels, and he will reveal what those are on Thursday. He did say the numbers in Hamilton and Montgomery counties remain worrisome, especially Cincinnati and Dayton. In some cases, the number of COVID-positive patients in standard hospital beds, ICUs, and ventilators have doubled since the first week of June. DeWine announced an increase in pop-up test sites in Cincinnati in the next several days. And even though Franklin County leads the state in cases, DeWine said Franklin County is on the radar, but we're not quite where those other 2 counties are just yet. Some good news: beginning July 20th, nursing homes are permitted to begin outdoor visitation as long as all safety standards are met. DeWine said the state is testing every nursing home right now and that the goal is to have staff continue to be tested. And once a nursing home has been cleared, that nursing home can, in fact, open up for visitation. The governor is extending the current health orders through the end of the week until a totally developed plan is in place. That means the current order on large gatherings that was set to expire Wednesday, July 1st, will continue through the week. And looking ahead to Thursday, the governor said he will announce the next phase of the state's reopening, along with the K-12 school reopening guidelines. He also said that there will be no briefing tomorrow, Tuesday. The next briefing is Thursday. If you missed any of the news conference, watch it on our website, abc6onyourside.com, and on our YouTube page. Just search for WSYX ABC6. We'll see you at 5.